Dr. Carrie Jones, welcome to the Keto Camp podcast.
Thanks, Ben. Oh my gosh, lovely to be here.
It's long overdue. I've been such a huge fan of your work, especially on Instagram. You've got one of the best health Instagrams I've ever seen, and I get so much value from it. And you got to be following Dr. Carrie Jones. And we'll talk all about the cool things you're doing with the Dutch test and all the cool things you're up to. But before we do, I'd love to hear and share your story with how you got into the health space. What got you inspired to get involved with what you're doing today?
Well, so I have known since I was a very little girl that I wanted to go into medicine. And so I knew women's health is what I wanted to do. I thought I wanted to be a midwife. I thought I wanted to be an OBGYN. I was going to deliver babies. And then when I got into college and I was pre-med, I was working at two different hospitals. One hospital I volunteered at was did a lot of community outreach, blood pressure, blood sugar education, weight loss, exercise. It was a lot of working with the community, education, and I just loved it. The other hospital, I worked in the pediatric wing, and it was very sterile, and it was very, take this medication, you need this surgery, terrible bedside manner, make sure the room is completely, sterilized afterwards, treat them and treat them, or treat them and treat them. And I was like, there's a time and a place, but this is not my time and it's not my place. And what I decided to do instead, is anyone in my shoes, is I thought, oh, I'll move to Oregon. So I moved from the Midwest, where I was going to school, on a whim. I moved to Portland, Oregon, and that's where I found naturopathic medicine, and I ended up in naturopathic medical school. Once I learned what more of a holistic approach, right, a naturopathic approach, really about education and how I could do women's health that way. That's what got me into it. And I just continued. I stuck with women's health, hormones. It's the only thing I know. I decided not to deliver babies, but I continued on with the women's health. And I joke to people all the time. Like people will ask me about their kids, I'm like, I don't know. I have no idea about your kids. Don't ask me, or like my husband will be like, my knee hurts. I'm like, babe, no, I don't know. You know what? But if you've got a problem, with estrogen detox, if something's going with your vagina, like I can help that.
Yeah, you stay in your lane. I totally respect that.
And I have a very strict lane for sure.
Yeah, and you're the pro at what you do, and that's for a reason. You don't spread yourself too wide. You go deep into a couple of categories, and that's women's health, which we'll get into. But I want to know, what made you choose Portland out of all the places you could have gone to?
So the real story is that a girlfriend of mine in college was chasing a boy, and he was a year ahead of us, and he happened to move to Portland, and she said, I don't want to move to Portland by myself. You're not going to medical school anymore. Any chance you want to move to Portland with me? And I was like, yeah, sure. Portland sounds great. And that's what we did. I followed her out to Portland so she could chase the boy. She didn't
Supportive
get the boy.
friends. She didn't get the boy.
She didn't get the boy, in fact, but she has she's an amazing boy and an amazing family. So it worked out for both of us completely in the end.
Awesome. It always works out, doesn't it?
Yeah, the universe is smart like that.
It does.
Yeah.
So was it a challenge for you to go to a conventional medical school, learn what they're teaching, and then kind of unlearn that and relearn more of the holistic approach?
Well, so in naturopathic school, we have to learn both. So in the state of Oregon, where I am, we are considered primary care physicians. And not every state allows this for NDs by far. I mean, Florida, like we're pretty much illegal in the state of Florida. But in the state of Oregon, I had to learn how to diagnose, how to treat, how to work somebody up in a conventional method. I had to learn what medications I would give. I had to learn minor surgery, all as part of my naturopathic training. Then on top of that, I learned all the naturopathic principles, herbs, homeopathy, more going holistic, diet, lifestyle, sleep, risk factor mitigation, all of that on top of it. So I had a really varied, diverse education, which made it great for the state that I was in. I know not everybody gets this kind of education. And I definitely walked the line. Like I can absolutely say to somebody, yeah, you know what, your pneumonia is pretty severe. You need to be on antibiotics and an inhaler, and I need to follow up with you. And on the flip side, I absolutely use a lot of herbal medication. I use homeopathy when it's needed. I like essential oils, I like Bach flower remedies. I refer people for acupuncture. Like I'm definitely, I sort of lean both sides of the road when it comes to medication versus sort of a more holistic approach.
Yeah, I think that's fantastic because you're not putting yourself in any box, either holistically or with the conventional norm. And you look at it as a case-by-case scenario. And I agree. There's a time and place for
Mm-hmm.
surgery. There's a time and place for antibiotics. And then there's a time and place for herbs and other things that you can use. So I love that you have both lenses on your patients, and that's really
Right.
cool.
Right. Yeah.
I'd like to know, I know you specialize in women's health. What's the main problem that you see? I'm trying to word this correctly.
What the one main
I know
problem?
you see many, but what's the most common one that you see with women's health?
I would say, well, I would narrow it down. I'd probably say, there's like, how would I describe this? There's like the metabolism category. And by metabolism, I mean either energy metabolism, so I'm tired, or actual metabolism, I've gained weight and I can't lose it. And then there's the hormonal category of, I have PMS, I have endometriosis, PCOS, adenomyosis, I can't get pregnant, I have a history of miscarriages, my menopause is awful. So it's kind of these two camps. And obviously the two camps can overlap. I'll have women come in and go, I am so tired, I can't lose weight, and my hot flashes suck, just as much as I'll have somebody who's pretty much, just has one camp or the other. So it usually falls in those two categories.
Yeah, and for me, what I've seen most common is similar. It's definitely I would just want more energy. I have no
Yeah.
energy. I wake up and my cortisol awakening response, they're not going to say that, but their cortisol
Right.
awakening response is shot. So
Yes.
let's talk about the energy. How does one go about that? If they wake up and it takes them about 2 hours just to get things up and running, and they have to have coffee, they have to have
Mhm.
these stimulants, what's something you would educate to that person?
So first thing I tell people is that there are a lot of reasons for low energy. Everyone just assumes it's cortisol, right? Everyone's like, oh, it's got to be my cortisol. I'm super tired. I'm like, well, remember, it could be something like B12. You might be B12 deficient. You might be anemic. It might be a thyroid issue. It might be a cortisol issue. It may be just the fact that you sleep like crap. You don't hit your deep sleep. You're sleeping with somebody who's snoring. You yourself snores. You co-sleep, which I'm not opposed to, but just it can get in the way for a lot of moms and dads who are trying to get some solid sleep. And so what I first do is really try to, of course, look at the cause, like what's really going on, and test. But when I do test, I'm looking for these things. I'm looking for low cortisol. I'm looking to see if their iron or ferritin markers aren't that great. I'm looking to see if their B12 is even just suboptimal, because we all talk about, there's the range and then there's the more optimal range. Because if the range is 10 to 100 and you're 11, it's like, you get told, oh, you're in range. Like, no, you're not. I mean, you are, but not really.
Hmm.
So when it comes to, I'm super tired when I wake up in the morning, I need 2 to 3 cups of coffee. I'm not quite alert. I start with cortisol, but I definitely make sure I run the gamut and not miss something.
Yeah, I love that. How important is it to get some morning sunlight?
So important. Like, I mean, I don't mean pun intended, like it's night and day difference, right? Like for the people who lay in bed in their dark room and play on their phone, I'm like, no, you have to at least get up, open your curtains, and then go back in bed and play on your phone. At least get some sunlight in and train your eyes, because it's the sunlight into your eyes, the brightness, the full spectrum light into your eyes that goes to your brain that says, hey brain, we've woken up, it's time to go. And you've got about a 20 to 30 minute kickoff where you switch from I'm conscious, I have my eyes open, to I'm alert and ready to go. And so it's a very good, like, clinical pearl question for people. Like, how long does it take you to be alert in the morning? And some people, like for myself, I mean, definitely mornings, I'm slow to go, but I'm generally a morning person. Within 20 to 30 minutes, I'm like, yeah, I'm up, I'm at him, I'm, feeding my dog, letting him out, downstairs, making tea, drinking water, getting ready to work out, happy. Versus other people, as your example, it takes me 2 hours, I need 2 cups of coffee. I'm like, okay, that you're not making that switch in your brain. There's definitely something going on and we need to help it.
Yeah, for me, it's my morning routine is essential for my day. If I
Mhm.
don't have my 60 minutes that I block out, I walk my dog, I do my meditation, I do my Joe Dispenza meditation.
Mhm.
I'm getting sunlight. I'm lucky and blessed to live in Miami where there's
I
a lot of sun.
know.
Because every morning the sun rises and it's beaming over here. But what if somebody
Right.
is in Seattle, Portland, or London where they get overcast? What are some things they can do?
So first of all, overcast is still okay. I tell people, even if it is overcast, still open up your curtains. Still, if as long as it's not like raining and cold necessarily, go outside, go get about 5-10 minutes of fresh air and fresh light. But if you wake up when it's dark, right? Lots of people now this time of year wake up and they're like, well, I get up at 6, it's still black outside. Like, all right, time to get a full spectrum light. So time to get on Amazon, time to do some research on full spectrum, broad spectrum light that gives you the sensation as if you're outside on a sunny day with blue sky. That's what you're going for. And you turn it on, there's like a box or a lamp or like an overhanging thing that can overhang your computer, and you turn it on in the morning for, 10 minutes up to a couple hours. I definitely know people who have the box in their office and they have one at home, and my dog is pulling on the cord of the computer.
What are you doing, Hank?
I know. What are you doing, Hank? Um, so they'll turn it on, and then you want it. I mean, you kind of want it within eye view. I tell people you don't have to stare at it, you don't have to like blind yourself looking at it, but don't just set it on the counter and walk away and hope it's good enough to light the room. Like, you want it when you're getting ready. I tell women, hey, when you're getting ready, when you're drying your hair, if you're putting on makeup or what have you, like set it on the bathroom counter right there. When you get to work, have it on your desk while you're typing and turn it on. And it can make a world of difference. If you do lay in bed, if you're that person who lays in bed and plays on your phone, then have it on your bedside table, and just turn it on. And eventually over time, it trains the brain. We get up in the morning. We get up in the morning. We get up in the morning. Because I get asked, well, how long does it take to retrain it? I'm like, well, how long have you trained it to be really tired? How long have you trained it to like lay in bed and hit snooze 4 times? How long have you trained it to be like a low cortisol response? And most people are like, oh, years.
Hmm.
Like, well, it's going to take some time. It's going to take a couple weeks, but it can work. It can work really, really well.
Yeah, I agree. Once you get into the routine of doing that, you'll create those new neural pathways, and all of a
Yep.
sudden it's second nature. According to University of College London, they say it takes 66 days to create that new neural groove.
I
Uh,
believe it.
I believe it too. Some people could be 30 days, some people 90 days, but that average is 66 days. So if you stick and stay, it's bound to pay. What
Yep.
about something like a sauna space, photon beam, or a
Mhm.
Juve red light therapy? Will that help as well?
Absolutely. Absolutely. 100%. And you can do both. I'll tell people, like, open up your blue light curtains, open up your blackout curtains, and then turn your light on. Do whatever you do in the morning, whether it's a 5 or 10 minute routine. Some people get right into their sauna. Some people turn their Juve on immediately. And I'm like, that's great. That's great. Go ahead and do that. And it will make a world of difference for a number of reasons, right? Sauna and Juve, like that red light therapy does so much for other things, mitochondria and things like that. But
Yeah, exactly. That's just
very
one of the
helpful.
benefits. Yeah, I have mine
Yeah.
right here actually. So when I finish with my walk, I'll come back on my office, and then I'll do the Joe Dispenza meditation while I have this on me for 30 minutes or so, 20 to 30 minutes. So
Nice.
that's my morning routine, and I don't check my phone because to me it's like playing Russian roulette. If I wake up and check my phone, it could be a great text message from
Yeah.
somebody or a wonderful comment on Instagram or a problem I have to solve, and all of a sudden I'm scrambling and my day
Yep.
is destroyed. So I
Yep.
protect
And you're
my
always
morning
thinking,
time.
right? You're always thinking back to that. Like, I need to deal with that. I need to deal with that right now. Oh, I'll just deal with it real quick, and then I'll go for a walk, and then I'll get some light, and then, right? But then the and then doesn't happen because you just keep domino affecting, trying to solve and fix and what have you. And you're right. It could be a super great morning. You could have super great positive feedback, but you can't
Not
ever
all the
guarantee
time.
that. Not all the time. We all know that.
Yeah, exactly. So I protect my morning routine, and I make sure I don't, because also the subconscious mind is very impressionable first thing in the
Mhm.
morning. So
Yes.
if you're waking up and watching the news or putting that stuff into your subconscious mind, then it's going to just manifest in
Yeah.
your day to day. So
Yep.
these are just some tips that you could take away. Take a couple things that we're talking about here and see what resonates with you. And I know,
Yeah.
and Carrie knows that it'll make a big difference for your day. You win the morning, you own the day. I'm a
Well,
big believer of that.
and the other one is supplements too. I think people forget when it comes to that cortisol awakening response that you mentioned earlier. You've got about, like I said, 20 to 30 minutes to make a difference. So you want to be getting the light within 20 to 30 minutes, but you also want to be considering to take your morning supplements within 20 to 30 minutes. So if you have been prescribed some kind of adrenal supplement, B vitamins, maybe vitamin C, whatever it is, some sort of tea that you're supposed to make to, improve your energy and well-being and cortisol and mitochondria, you want to do it right away. Because what most people do is they get up, they do their morning routine, they eat, they shower, they go to work, and then they take their supplements, which can be helpful for the mid-morning. But if you're tired on waking, then you have to address it on waking. And I know that some vitamins are a pain on an empty stomach. A lot of people don't like B vitamins. It makes them nauseous. I understand. Then maybe choose the other vitamins. If you've been given an herbal blend or vitamin C or something, I'm like, do that in the morning, right when you wake up. Which leads to the next question is, oh, I take thyroid first thing in the morning. Can I take these with thyroid? Run them by your practitioner. As a matter of fact, a lot of supplements you can take with thyroid. They're specific. You can't: iron, calcium, magnesium, things with phytates in them. But there are a number of adaptogens, vitamin C, things like that you actually can take within a couple minutes or within 30 minutes of your thyroid medication. And it's actually fine. It's not going to hinder absorption. So you know, it's just, you do what you can, but timing is everything. Timing is everything. And I don't think people realize that.
Yeah, that's an important message. Timing is everything. So if you have those supplements, those teas, it's best to have it first thing in the morning when you're supposed to have it.
Right.
What are some teas specifically that help with adrenal health and just morning energy?
So there's a number of teas out there that have like a licorice blends in them. You know, there's some that have adaptogens in them that have like eleutherococcus and ashwagandha and just other supportive herbs that are helpful. So there's detox, you know, type teas. And even though like I know the detox tea industry is a joke, but the actual herbs in them sometimes are actually quite adaptogenic. So they're not going to like make you lose 50 pounds in a week, but they may actually be really nutritive and supportive, assuming you get an organic company that's using appropriate, you know, tea bags, not tea bags that are full of plastic. And so things, you know, you can drink those teas in the morning and still feel good about yourself and what you're doing. And it's going to be really helpful for your entire brain down to adrenal axis. Like every
How?
morning I drink green tea.
Oh, you do.
I don't do coffee. I do green tea every morning. And so that's my go-to. In fact,
And
I have
you
it
and
right now.
is it matcha or is it regular green tea?
In the morning, I do regular green tea. Yep, in the morning, jasmine. Jasmine is my favorite. Jasmine, some sort of jasmine green tea. And then usually either mid morning or mid afternoon, I'll do if I need it, I'll do matcha for the theanine effect.
So
I
do you
just
work out after you have the green tea? Do you work out on an empty stomach?
I work out on an empty stomach, and I usually have the green tea after, only because I don't have the patience to make it and drink it and then work out in the morning. I usually get up and work out first thing. I will let my dog out. The dog is definitely part of my routine, right? Let my dog out, feed my dog, and I will either work out and then walk my dog, or walk my dog and then work out, and then I do, you know, my lemon water and my tea.
Awesome. I love it.
Yeah,
Okay, I have a lot of questions for you.
let's do it. I'm ready.
I'm so
Now that
excited.
we're awake, now that we're
Yeah,
alert.
now that we're awake. Let's talk a little bit about the role healthy fats play with our hormones. How important is it to get the right fats for hormonal health?
Super important, super important. And I think people realize this when you are too underweight, right? There's the fat-free fad that went on forever and ever. Don't eat fat. Fat's bad for you. And then women's hormones just, you know, went to hell in a handbasket, because cholesterol is the backbone to all of our hormones. We need that healthy fat to even make a hormone in the first place. And I think a lot of people forget that when it comes to basic biochemistry. And so when I talk to women who were like, "Oh, I don't eat fat. I'm on a completely fat-free diet. I don't believe in fat. Fat scares me. Fat makes you fat." I'm like, right, except you're not ovulating. You can't get pregnant. Your skin doesn't look good. You're breaking out. Your hair is greasy or dry and falling out, sort of depending. And I'm like, we need to change your diet. We need to get you that fat, one, to make a hormone, but two, just to make your cellular health that much better. You know, your cell membranes are lipid bilayers. So we need lipids. We need lipids to make them fluid and happy, so the hormone that's made on the inside can, you know, get out to the outside and circulate around. So that's really important. And
Yeah.
then we know with athletes, right? Like think of your classic gymnast, your classic like runner, professional runner. I see these girls in high school that are distance runners, and they're just, you know, total bean poles. And I would see them as patients all the time. And all the time I'm like, "Tell me about your cycle." And they're like, "Well, I haven't had one in 6 months. Well, I haven't had one in a year. Well, I get it sporadically." And I understand. I know it's really it's hard, because they're in a sport they love and are trying to get to nationals or maybe even pre-Olympic or college. And yet, you know, it's completely destroyed their hormones because their body fat percent has dropped down so much as they stay competitive. And it's tough. It's tough on the hormones, which then makes it tough on the brain, tough on the bones, tough on the heart, tough on the skin. You know, estrogen, progesterone, testosterone, it, they're tied in. Like, you can't separate one from the other.
I used to own a CrossFit gym in here in Miami for a few years, and I used to see that a few times where
Mhm.
the female members, they stopped having their period, and they would come to
Yeah.
me and ask me what they should do, and I say, train less, you know,
Yeah.
stop working out so much, get
Yeah.
an extra hour of sleep, or do some stretching or walking,
Yeah.
because the body is not going to want to have a baby if it's in survival mode, right? What exactly
Yeah.
is happening there?
There's a feedback loop. And so when you're stressed, now again, like, we think of stress as like, oh, a bad text, a bad job, a fight with a partner. You know, we think of like external stress, but internal stress can happen as well. I got an email from a woman who does Soul Cycle twice a day, 6 days a week. And she said, "I haven't had a period in months. And do you think I'm exercising too hard?" And I was like, "Yeah, kind of." What happens is that chronic, ongoing, maxing exercise raises cortisol, When you make a lot of cortisol, it tells, there's a feedback loop. There's a switch in the brain that goes, oh, that's a lot of cortisol. And the hormone that tells the body to make estrogen and progesterone goes down. Because the brain's like, well, if I'm constantly running, training, maxing out, we don't have time to raise a baby. I don't have time to get pregnant. I don't have time to grow a baby. I don't have time to feed a baby. So we're not going to make a baby. And so cortisol tells the brain to tell the ovaries, don't make estrogen, don't make progesterone, not now. And so the ovaries go, okay, right? They're at the direction of the brain. And so as women, we lose ovulation, which is usually the first to go. We don't ovulate, therefore we don't make progesterone. Now we're estrogen dominant. And then over time, we lose estrogen as well. We often lose our cycles, we'll become irregular cycle. And then we start to have bone issues, skin issues, brain issues, things like that. We can't get pregnant.
Yeah. So if you're listening
it's
to
a
this,
signal. And so just like you said, where you tell women like, hey, go for a walk. And not like a competitive walk. Because how many times have you told a woman like, hey, go for a walk. And she's like, as fast as she can, squeezing, her legs and her buns as she's going. And I'm like, not that kind of walk. The kind of walk where you like stroll in your neighborhood and check out your neighbor's houses, like that kind of walk. Do stretching, do yoga, but maybe not like extreme hot yoga for an hour and a half. Just do nourishing yoga,
Yeah, great advice there. So I want to go back to the fat component.
Yeah.
Our cells are made up of fat, our cell membrane, protein, saturated fat, cholesterol, the brain, 70, 80% fat.
Yeah. Yep.
We know that it's important. What are some of your favorite fats that you personally like to eat?
I do a lot of, personally, my body responds well to a lot of olive oil. I do a lot of olive oil, and I do a lot of avocado. I do a lot of fish oil. I do higher dose. I'll do 4 to 5 grams of fish oil, EPA, DHA a day for myself. And I feel amazing when I do that. Now I've done, my genetics sort of several times over, and I've had a few people who've read my outcome who are like, oh, you need more fish oil than the average person. Like, great, okay, I can do that. Whereas most people are taking, 500 to 1,000 milligrams, and so you can take more. So that's usually, but again, that's what works for my body. What I do eat meat, which of course there's fat in meat. I do fatty fish. I like salmon. I live in the Pacific Northwest. We get a lot of great salmon, and so those are some of the things that I look at.
What are some of the bad fats that do the opposite of what we're talking about here?
Oh, things like, they'll think of all your fried foods, right? French fries and chicken tenders and all the peanut oil, the canola oil, the soybean oil that they're frying those foods in. Like those are all the ones that are sort of ruin our antioxidant status, right? They're the ones that become rancid really easily. They're the ones that are maybe causing damage to the body, and therefore making us feel terrible. When you sit down and eat a basket of fries, I guarantee you most people don't get up and go, that was amazing. I feel so healthy. I feel so good. My hormones were singing after that one.
Yeah,
we may
never
need it, right? Like we all, we've all had a basket of fries, but definitely we don't get up from a basket of fries and go, that was the same as eating a salad.
Yeah, that never happens.
Yeah, never ever.
So the industrial seed oils, the vegetable oils, the fried foods, definitely want to avoid or limit those as much as possible.
As much as you can. And obviously, you do the best you can. I have
Yes.
people that are like, I can't, like, that's pretty impossible. I'm like, just do what you can. Baby steps. It's all right. If you're new to this, it's just go one step at a time.
Exactly. My shirt says beat yesterday, and that's exactly what you're saying.
I love that. I was trying to read your shirt earlier. Like I could see the beat, but not the yesterday.
Yeah. So that's exactly why I have this shirt, because it reminds myself and other people that you don't have to be perfect. You just got to beat yesterday. It's small steps that really, it's that compound effect that add up. And a lot of the information that we talk about here and on the podcast and on my YouTube channel, it could be overwhelming to a lot of people. And they're like, oh my God, toxicity of the cells and silver fillings and root canals and estrogen dominance. So just start with one thing. You start with one thing that resonated with you. You get good at that, and then you add something else. And that's what we're talking about here.
Absolutely. And the same goes for hormones. The same and especially when you're hormonal, male or female, it doesn't matter. When you're hormonal, then everything's doubly overwhelming, because you're already feeling unbalanced in the hormones. Therefore, you're going to sort of feel unbalanced in everything that you do, and it's going to make it feel more of a challenge. And it's just, you'll get there. It's fine.
Exactly. You'll get there. Just keep going.
Yeah, exactly.
I want to talk about the Dutch test. The Dutch test is, I run it on all of my one-on-one clients. It's such an amazing test. It gives me some good data. It doesn't give me cause, but it gives me a lot of good data to what's going on with the hormones and with the adrenal glands. So talk about the Dutch test. And let's go deep into this test that I love so
My
much.
favorite test, your favorite
Yeah,
test.
yeah.
So the Dutch test, it's an acronym. It stands for Dried Urine Test for Comprehensive Hormones. We do not test for Dutch heritage, although I just got asked that the other weekend. And so it's basically a test where you urinate on pieces of filter paper. For women, I say it's like when you took a pregnancy test or an LH test. You just urinate on these pieces of filter paper 4, if not 5 times in a day, because you want the circadian rhythm. You let the filter paper dry, fold it up, mail it back to the lab. The reason it's really handy is because you get the circadian rhythm in the day. I'm going to tell you your cortisol. I'm going to tell you your melatonin. I'm going to tell you your DHEA. I'm going to give you this look of your energy or not through your day. But the urine part of it, which was what makes it so fancy, is that we get your hormones and we get where your hormones are going. So you make a hormone, men and women, you make an estrogen, because men make estrogen, but it has to go somewhere. You have to detoxify it out of the body once it's done. So you go through phase 1, phase 2, and phase 3 detox. And in the Dutch test, we give you phase 1 and phase 2, which are predominantly done in the liver. Now, phase 3 is done in the intestines. That's stool testing. We're not a stool company. We don't test poop. So at least we can give you phase 1 and 2. When it comes to testosterone, women who are like, I got my blood work done and it's normal, but yet I have acne on the jawline. I have hair growth in places I don't want. It's thick and coarse and dark. I'm losing the hair on my head. I'm getting a receding hairline. What is going on? I can look at her pattern on a Dutch test and go, oh, you make testosterone normally, but when you are done with it and you process it, it's going down that pathway that's causing acne and hair growth and hair loss on your head and all this stuff. And the great thing is, like regards to estrogen, regards to testosterone, everything is modifiable, whether it's through diet and lifestyle, whether it's through supplementation, both. Like that's what's so great is that you can be very proactive when you learn this stuff as a person. Like, oh, you mean if I do this thing, my acne can improve? Yeah, absolutely. You mean if I eat this food, my risk for breast cancer can go down? Yeah, actually it can. And it's really exciting for people.
It's a great test to see somebody's risk of breast cancer because it shows you the 3 pathways the estrogen is going down,
Yeah.
and it could potentially, it will show you if it's going to cause some DNA damage. So you have a great analogy about a bathtub analogy. Could you give that and explain
Yes,
exactly what that
my
is?
my clawfoot bathtub. Yes, and it's always a clawfoot bathtub because if you've heard me talk before, it's I'm extra, therefore my bathtub is extra. So when you have estrogen, male or female, you make an estrogen. You're done with your estrogen goes down 3 pathways. You go down a 2 pathway, a 4 pathway, or a 16 pathway. So the 2 pathway is considered less carcinogenic. It's the more ideal pathway you want, less cancer risk. There's still some, but less. The 4 pathway is the most carcinogenic. If you go down that pathway, your risk for damaging DNA is the highest. The 16 pathway, we call it the proliferative pathway. It makes things grow. Great for bones, bad for things like breast tissue, bad for things like the lining of the uterus, and now you have heavy periods or clots, polyps, things like that. So you have these 3 options. That's the water coming into your bathtub. What kind of water do you have? Is it 2? Is it 4? Is it 16? Is it coming in fast? Is it coming in slow? Now, once you have that water, you have to neutralize it. That's your drain. When you neutralize it, you go through a process called methylation. Methylation basically is where you take that 2, 4, 16 and make it less reactive. You neutralize it. Once you get into the drain, now you have to get out of the sewer line, out of your house, which is essentially your intestines. You go from a neutral estrogen dumped into the bile, into your intestines, and then of course you are supposed to excrete most of it out. But if you have an unhealthy microbiome, lots of gas, bloating, constipation, diarrhea, microbiome issues, bugs, bacteria, parasites, then you may actually end up absorbing your estrogen versus excreting it. And now you have to do the whole process over again, and the body gets frustrated and you get symptomatic. So it's the water, it's the drain, and it's the sewer line. Your phase 1, your phase 2, and your phase 3. So I teach it in that direction from the water, drain, sewer line. But of course you address it, you treat it 3, 2, 1. You want to unblock your sewer line, right? Unclog that. Then you want to open your drain, and then you want to address the water. Because think about your bathtub. If you just keep addressing the water, you just keep trying to shift the water, slow the water down, change the water color, but your drain and your sewer line in your house are backed up, you're still going to overflow. You're still going to have a hot, wet mess all over the floor. So you have to start with the sewer, start with the intestines, and then work backwards.
Yeah, it's a great analogy, and it makes so much sense, especially to somebody who doesn't really understand the 2 4 16. What does all that mean?
Right.
You just think of this bathtub analogy, and you can listen to this over and over again to really understand what Carrie is talking about here. So, how important is it to be going every day and pooping? How? What are the dangers?
Very,
Yeah, what are
very,
the
very
dangers of
important.
somebody who's constipated? What are the dangers of constipation?
So if you're an estrogen, when you're an estrogen and you've been used up and you've gone through the water and through the drain, basically. So my analogy is your body puts it in a box, ties a bow on it, sticks it in your stool, and is like, all right, time to go out, time to go on the boat, like out of the sewer line and out of the intestines, right? But when you're constipated, the box sits there, and then what happens is it gets opened up and the estrogen gets reabsorbed because it's just sitting there, just sitting there in your intestines, and your body, unravels the bow, and now you reabsorb it. So you thought you were estrogen dominant because your body was making too much, but really what's happening is you are reabsorbing the naughty estrogen that was tagged to get eliminated. It's not getting eliminated, it's just sitting there because you're constipated. So it gets reabsorbed. And now it circulates all over again. And men and women have high estrogen type symptoms. And so you have to be pooping every day because you need that sewer line open, just like you need the sewer line open to your house. If the sewer line in your house is clogged, every single drain in your house will back up, and it smells, and it's disgusting. And it's the same in the body. If you're not pooping every day, then you're constantly going to be reabsorbing not just estrogen, although that's our topic. You're going to be reabsorbing lots of chemicals, lots of toxins, lots of things that maybe you don't want to because it was tagged to be excreted. It was tagged to go, but it's coming back in and recirculating around.
So, what are some things that you could share here to help somebody who's constipated right now?
Right now. What do you do
At
right
this
now?
very
At
moment.
this very moment.
They're driving in
So
their car listening to this.
they're like, what should I do? Hydration is huge. I find, as you probably do too, a lot of people are really underhydrated. In fact, they'll listen to this podcast and they'll go, oh man, I haven't had but maybe half a cup of water today, or I've had a cup of coffee, but I have had no water. I should probably hydrate. So hydration is hugely important. Diet is hugely important. Americans, really all first world countries, we're lacking in fiber. We've got to get our fiber and we've got to eat our veggies. Very, very important for helping bulk up our stool and move it out of the body. And of course, the hydration to continue that process along. Fixing our microbiome is really important, the terrain of our intestines. So eating a diverse diet, eating organic, avoiding things that are sprayed, because the spray will affect our microbiome, our gut bugs. Looking at things like prebiotics and probiotics, or looking at fermented foods, if that works for you. So, and notice I haven't even said anything, like I haven't talked about a medication, I haven't talked about an herb, I haven't talked about, a supplement. Like everything can be done a lot through some of these changes. Getting good sleep. People don't realize this. When you are not sleeping well, it puts the body in a state of fight or flight and stress, right? You don't wake up repaired, you don't wake up refreshed. And so it slows the whole GI tract down, because if you're running from a tiger, now is not the time to be like, oh, you know what? Like, I think I need to have a bowel movement right now. It's like, no. You got to like run through your day. You've got to get moving. So I tell people, addressing your stress, being mindful, whatever that means for you, getting good sleep, hydrating, lifestyle, fiber. All of these are just the very, very basics. People will ask me, well, can I just take magnesium? You can, but if you're not going to address anything else, it's never going to be fixed. People will say, well, oh, can I take this stimulant, this stool, stimulant? I'm like, well, you can, but it's not going to, if you don't address everything else, the basics, then you're really going to struggle. Other things people don't remember or think about are like thyroid. When you have hypothyroidism, even subclinical, even like a little bit, kinda, it slows everything down, right? It slows hair growth down, it slows metabolism down, it slows skin turnover down, it slows down your GI tract. And so by getting your thyroid properly tested and addressed, however that means, can be really helpful for the GI tract.
Those are some solid tips right there.
Right? Like, so that person who's driving in the car right now, you better, hopefully you have a bottle, your stainless steel water bottle.
Yes, yeah, not plastic. Yeah.
Not plastic, and you drink the whole thing. Hydrate yourself.
Hydrate yourself and do all the things that or some of the things, whatever resonated with you that Carrie just mentioned.
Yeah.
There was a couple of things you said there. Sleep is very important also because the liver is very active overnight. It dumps bile overnight, and that's where your toxins are. That's important to make sure you have that activity going on. And then you also mentioned the thyroid. So what I've seen is I work a lot with clients who have mercury toxicity. I've had it myself.
Mm-hmm.
Mercury has an affinity for that thyroid gland. So if
Mm-hmm.
somebody has a mouthful of amalgam fillings, that's also something that needs to be addressed properly, of course.
Right.
But there's some things that you could piece together. Like if you have a mouthful of silver fillings, you're not drinking water, you're constipated, like there's some things to work with there.
Yep.
I want to talk about two types of women, because I have most of my clients are women. A lot of
Mm-hmm.
my audience is mostly women, and I work a lot with women. And I teach the keto diet, but the way I teach the keto diet is not the way a lot of people teach it. It's
Okay.
very different. I teach keto flexing. I think it's important to teach the body to burn fat for fuel
Mm-hmm.
most of the time, but not all the time. I think it's important to get a spike of healthy carb, insulin spike from healthy carbs from time to time, especially women I work with that are having their monthly cycle. The
Yeah.
way I teach them to do it is, hey, 7 days leading up to your period, I don't want you to practice keto. I don't want you to practice fasting. I want you to eat these foods, squash, ancient grains,
Mm-hmm.
some citrus fruits. It's going to help you stimulate some more progesterone to help of the monthly cycle. So that's the way I teach it. And I want to share that because I also want you to share for those women who have a monthly cycle, what are some ways to do keto that are going to help them get the results of burning fat for fuel, but are not going to be too restrictive where it affects their hormones. Do you have any advice
I
for
was
that?
going to say, see, that's what I love that so much. And I love that you teach that because obviously, of course, I follow you on Instagram. So I see what you say. And I think that's so important because what I hear is I will hear some women, now not all, but I will hear some women who will write me and go, I did keto. I did it 100%. I, had the strips. I followed these experts. I was diligent about it. And maybe they, lost weight or got more energy or got the brain clarity, but their hormones tanked out. And we will see this because I work for a lab company. I will see it written on the form. So lots of patients will send the test back. And as one of the, as the medical director, I get to read over a lot of people's tests and they'll say, tried keto for 4 months, hormones feel horrible. Did keto for 6 months, can't get pregnant, don't ovulate, and so I'll see all these things. And it's, a couple of reasons, like maybe they didn't do it right. They're not my patient, so I don't know how they did it. But on the other hand, I feel it's that exact thing. I think just for some women that doing, I guess, all out or complete keto is too much for them. It affects their brain signaling down to their ovaries or their adrenals or their thyroid, and they fall apart. They do great the first couple months, because they usually cut out the crap. They cut out sugar and they cut out, refined carbs, and they reduce their alcohol significantly, and they drink lots more water, and they're more aware. And then after a while, the body's like, "Oh, I don't like this. This is too much. Like, I'm not making a baby. No way. I'm not ovulating. No way." And when I watch you, when you talk about flexing, I'm like, yeah, that's so awesome because it's those 7 days before the cycle when the progesterone's supposed to be the highest, and it's affecting our, our blood sugar and our insulin as women. We're in a constant state of dynamic flux if we cycle. And by getting that flexibility, then the body doesn't need to freak out. It doesn't need to stress out. It's like, oh, she totally had, squash today and she had citrus and she had whatever, quinoa and like, okay, like, all right, well, good. We're good. Like, met the demands, not feeling like I'm too stressed out. It's going to be okay. And I see that when women do that, they tend to do so much better. They tend to feel so much better. Absolutely, there are women who are going to listen to this and go, well, I do all keto all the time and I feel great. I have normal hormonal issues. I'm like, great. You're not who I'm talking to. You're not who I see. You're not the one running the Dutch test and writing your complaints on the requisition form. But for all the women who are, and even men too, I have men that say, I did strict keto. I was very diligent. I followed how you're supposed to do it. And, my thyroid did this, or my cortisol did this, or I feel horrible. And I'm like, yeah, maybe you need some flexibility as well.
I love it. Great stuff, Carrie. And for men too, even for myself, I flex out. I don't do it as often as I would tell somebody, a woman who has her monthly cycle. But for my
Right.
male clients, I tell them, look, we don't want you to stay in ketosis all the time because, well, first of all, if you study ancient culture, there's not one culture in the history of this world that ever stuck with one diet strict
Mm-hmm.
long term. They
Mm-hmm.
always adapted to their environment. So just knowing that fact that we're meant to adapt, our cells love that adaptation, because when we force the adaptation, the cells that we have in our body, they get stronger. The bad cells don't adapt. And that's something I learned from my coach, Dr. Pampa. So
Oh yeah.
adaptation is key. And also the dangers of staying in ketosis too long, months and even years for some people. When you have chronically low insulin levels, you don't get any insulin spike, and that helps T4 convert to T3.
Right.
All of a sudden, you're getting your thyroid is dysfunctioning, or you're having low amounts of T3, and you don't feel good. You're storing fat. So everything we're
Right.
talking about here is not a cookie cutter approach. It's things we've seen, things we want to share, some pieces to the puzzle for the audience to listen to and see what resonates with them. But there's not one way to do keto. There's not one way to do any of this. It's very
Yeah.
customized to the person.
Yeah, absolutely. Even like leptin, I will have women who have too low of leptin levels. We talk about leptin resistance, all the time, similar to insulin resistance. But absolutely, leptin is a key trigger for ovulation. It's a key trigger for that hormone in the brain to talk down to the ovaries, the GnRH. And for those women who are very low leptin, they'll say, I have all sorts of cycle issues. I have all sorts of fertility issues. I'm irregular cycles. I have no cycles. I can't ovulate. I'll check their leptin. Sure enough, it's in the way low single digits. And I'm like, yeah, man, this is a big trigger. It's a big signaling hormone. It's a fat hormone. But when it's really low, if you have really low, especially if you have really low fat count or fat percentage, then it doesn't have the oomph to kind of tell the brain, like, all right, we're good. We have enough energy reserves to have a cycle. She's strong enough to carry a baby. Even if the woman doesn't want a baby, I'll have, women are like, well, I'm not trying to get pregnant. I just want my cycle. I'm like, I know that. But the brain is like, every month it's about reproduction, whether you want it or not. That's how we have to think. And so if the leptin is too low, if the insulin is too low, then we're not going to get these triggers of she's in a healthy enough state for us to maintain a pregnancy. So let's not make those hormones.
Plus, she's going to be hungry all the time.
And mean.
And mean and just irritable. Yeah. We don't want to
Yes.
be around somebody with low
Yes.
leptin. That's not going to be fun. Yeah, all hormones
Yeah.
are pulsatile. They're meant to spike and go back down. They're not meant to just stay down or stay high. They're meant to be pulsatile. So I have so many
Absolutely.
more questions for you. I want to talk about a cycling woman. Let's stay on the topic of cycling women, and then we'll talk about postmenopausal. A cycling woman who has heavy periods, what are some things they can do to help with that?
Absolutely. So heavy periods for a couple of reasons. The three big ones I would, 3.5 big ones. So is it because you have low progesterone? Is it because you are iron deficient? Is it because you have low thyroid? And then we just want to make sure, depending on how heavy you are, you don't have a bleeding disorder. So assuming it's not a bleeding disorder, what we're looking for then are iron, thyroid, and estrogen. So for women, first and foremost, a lot of women are just not in tune with their cycle. They assume they ovulate every month. They actually have no idea. Because I'll have women go, well, I get a period every month. Like, I know, but that doesn't actually tell me if you ovulate. You can have what's called an anovulatory cycle, which you don't release an egg. Why is that important? Because when you release an egg, that's when you make progesterone. And progesterone is our calming, soothing, everything is going to be okay hormone. It's also the counter to estrogen and makes us have nicer, not so heavy cycles, right? When we have enough progesterone, our bleeding is usually really easy and really straightforward, not full of clots. Not very thick. And so we want to release an egg. We want to make progesterone. So we have that balance. Now, on the flip side, though, some women just have lots of estrogen. We talked about the constipated woman earlier. So if you are recycling a lot of estrogen, you're going to be very estrogen dominant. That makes things grow and get fluffy. Well, then it has to bleed off. So all this thick fluffiness comes off, and it usually results in heavy periods, lots of clots. And it's exhausting because there goes, as well, there goes all your iron, because you bleed with, the more you bleed out, the more iron you bleed out with it. And so correcting estrogen, progesterone, but finding out if you ovulate is big. And that's looking at symptoms, that's tracking temperatures, that's understanding, do you get the twinge, like sort of like in the lower quadrant of your abdomen in the mid-cycle. So just sort of paying attention. And it's amazing the number of women that go, oh my gosh, some months I do and some months I don't. I'm like, I bet some months you have good periods and some months you have bad periods. She's like, yep, I absolutely do. So paying attention is a big one for that. Now, how do you get yourself to ovulate? You need good brain communication down to the ovaries. So we're looking at things like B vitamins. We're looking at things like vitamin B6. We're looking at things that will support the cells that make progesterone. Those are your carotenoids. So these are like, they're called lutein cells because they're high in lutein, right? So eating the colorful foods, the oranges, the reds, even some of the green foods that are high in carotenoids, high in lutein, can be really, really helpful. Supporting the cellular health, looking at your oils, picking the healthy oils, avoiding the, kind of the fried vegetable oils, looking at fish oil, get your cells really healthy so they can communicate with each other through these hormones. The other big one is just circulation. When you were trying to communicate from the brain to the ovaries, it's done through circulation. So if you were a tight muscled, like shoulders uneven, got your shoulders up here when you work all day long, you've got your head jutted forward because you're on your computer or looking down at your phone all day. When you've got all sorts of bones, if your bones are out of alignment, if you're just a hot mess up in this area, then you're not going to be able to circulate your hormones very well. So I tell people, you may need to, really work on massage, acupuncture, chiropractic. You might really need to see a physical therapist. You might need to do a lot of upper body stretching. You might need to do Epsom salt baths, hot baths to bring the shoulders down, to relax the muscles. Do inversion poses if you're into yoga, doing exercise, get the blood flow going. I mean, just some I know I'm saying a lot of things, but a lot of these things are pretty straightforward and basic. Like learn if you ovulate, untangle your shoulders from out of your ears, seek help if you need it, get the communication going through circulation, and that'll really help estrogen and progesterone. Now, of course, there are things you can take to improve it, right? You can take progesterone. There are herbs that help you make progesterone, but you can take progesterone all you want. But if you don't address the cause, then you're never going to actually make it yourself or make it in healthy manners.
Yeah. Great tips. I love that.
Yeah.
Okay. Let's move on to postmenopausal women.
Yes.
What are some things postmenopausal women usually have low progesterone and estrogen, correct?
Yes.
Is that correct? Okay.
Yep.
So what are some things you can implement? What are some things they could implement to help them feel better and just get better results with their health?
So once the ovaries are done, just like you said, the estrogen and progesterone go really low, and it's the adrenal gland's job to pick up the slack. The hypothalamic pituitary adrenal HPA axis picks up the slack in a sense. So I tell women going into menopause, you have to be super diligent about your stress response, how you handle stress, your self-care in your day, your sleep cycle, your exercise, your diet. You have to be even more diligent than you were in your 20s and 30s and early 40s. Because what happens is women go into menopause and they go, I don't understand. I didn't change my diet. I didn't change my exercise. And now I'm 49 and I have hot flashes and night sweats. I've put on 15 pounds and I feel like crap. What did I do wrong? I'm like, you did nothing wrong. You entered menopause. It's reverse puberty. It sucks. I don't know why we have to go through it. When I'm the goddess of the universe, I will change it, but I'm not there yet. So what I tell women is, because it's like reverse puberty, you have to just take extra care of yourself. You have to be, if you've been always doing what you always did, it's time to change it up. If you've always had the same kind of diet, it's not working, like let's start experimenting with some other stuff. If you've always done the same exercise plan, you run 3 miles 3 days a week and that's not working, it's probably too much cardio. Let's change it up. Let's start doing some weights. Let's start doing maybe some HIIT. Let's add in some yoga or stretching. Let's see what we can do here. Let's do self-care. And then let's do herbal support. Let's do herbal support like ashwagandha. Like these are more, we call them adaptogens. So they sort of support the whole body, right? Let's look at things like rhodiola. Let's look at things like eleutherococcus. Let's look at some of the traditional menopausal herbs like sage, like black cohosh, like dong quai, like, which is angelica. Like some of these just nourishing all around. Cordyceps, the mushroom cordyceps, maca. There's some really great herbs out there that are super supportive for brain health, adrenal health, menopausal women as they're making this transition, and it sucks, right?
Yeah.
Now, there are women that are listening who are like, well, mine's great. I'm like, oh, well, I'm not talking to you. But these things can be really, really helpful.
Yeah. I'm glad I'm a guy.
I know. I have so many men that tell. My husband says that too all the time. My husband's always like, God, when you go through menopause, that's gonna suck. I'm like, hey, thanks.
Thanks, honey.
I know. The two owners of Dutch we're the same age, and their wives, the wives are roughly within, I think, probably 5 years of each other. So the two owners are like, great, our two wives and the medical director at the same time. Like, yep, we're working on a cure. Instead of my joke, we're working on the cure for menopause.
Well, that would be a moneymaker.
It would be a moneymaker. Yeah, absolutely. But I think it's just a time for women. They really have to just, they can't fake it anymore. If they're drinking 2 or 3 glasses of wine a night, like you can't do that in menopause. Not if you're symptomatic. If you're really enjoying that sugar binge more than you should, like you just can't in menopause. You've got to tighten the sails and really pay attention.
So we have a few minutes left. I want to make
Yeah,
sure I get to this last question, and then I
please.
have two quick questions to finish up with. So when I met my girlfriend about 4.5 years ago, she was on the birth control pill. And when I
Oh,
found out, like 30 days into the relationship, I was like, uh, I was, what's the word I'm looking for? Surprised. And also, I didn't know how to talk about that subject because I was very passionate about being against the birth control pill. And I've studied and what it's done to a female's health and hormones. And
hmm,
even to this day, I talk about it, but I'm a guy, and it's different when a guy talks about it
yeah.
versus a woman, especially a doctor. So I'd love for you to share about the dangers of the birth control pill real quickly. We don't have to get into it
Yeah.
deeply. But to go back to my girlfriend real quick, a few months into the relationship, I gave her some research. I explained to her, and she's been off of it for since then. And her
Okay.
hormones regulated, and she's felt so much better. So I wanted to just close that loop. But what are some of the dangers of the birth control pill?
Well, I mean, I'll be honest. I'll start out by saying that I'm not against the birth control pill. Only in the fact that it's not. I give women just like you did. I give them the information, and then it's their decision. Sometimes the pill is they think is the best thing for them, and we're just going to risk factor mitigate, right? We're just gonna do the best we can. And other women are like, nope, this is not for me. You're correct. I'm going to go off and let's find me something else. So dangers of the birth control pill, definitely lots of research coming out about it, how it changes women's mood. It changes the way they see their partner. It changes the way they view, can assess danger in a situation. It changes their microbiome in their gut, so it affects their gut health. It affects their blood sugar and insulin. It drives their testosterone down. So they go on the birth control pill so they can, a lot of women will go on the pill so that they can have sex without worrying about becoming pregnant, except their testosterone drives down, so now they're not in the mood, and so they're depressed on top of it. It can increase weight because of that whole blood sugar insulin thing. It could potentially increase the risk for things like blood clots, which of course is very scary. Oral estrogen can thicken the blood and affect the way we form clots in the body. It can change the health of our vaginal microbiome. So I talked about the gut microbiome. It could absolutely affect that. I've had women with chronic yeast infections, chronic BV, chronic just itchiness, and they can't figure it out. Should I go on? The list keeps going.
Yeah, no, my girlfriend experienced a lot of that. She had the yeast
Yeah,
infection. So yeah, I just wanted to just for you to share that. And just the
yeah.
goal is not to just scare people and say get off your pill. That's not the answer.
No,
It's
yeah.
to maybe do a little bit of some research and and learn a little bit about what it's doing to the body. So you did a great
It's,
job.
and especially if women are listening to this going, I have a lot of those symptoms, and not one doctor has told me it could be my birth control pill. That's what irritates me when they're like, I have chronic migraines and I have whatever, chronic yeast, and I'm gained weight. Do you think it's my pill? And they're like, no, that's not it. Like, really? Are you sure? Because it might be. Maybe go off the pill and give it a couple months and see if all those things go away. Yeah,
And
that's bad.
yeah, me too. It's ridiculous.
Hmm.
My girlfriend's doctor, when she was a teenager, I think she was like 15, put her on the birth control pills because she was having acne and heavy periods.
Yeah.
And she stayed on it until she was 26, 27 years old. And it really messed up her hormones, and she's still working on balancing it.
Hmm.
Okay, but we're running out of time here. I just want to ask you two questions.
Yes.
Number one, what are you grateful for today?
My dog,
Hank.
Hank, my dog Hank, who has been like, I'm trying to be all cool up here, is meanwhile as he's like all over the floor down below me. We just adopted him
Beautiful.
in June, so
Oh,
he is a huge burst of oxytocin the last couple months. So big fan of my dog Hank.
yeah, right on. Hank, I saw him earlier. He's
Yeah.
beautiful. What's the most exciting thing that you're working on right now?
Ooh, education. So Dutch has really taken on a big education role. We realize that there is a need for more specialized and specific directed endocrine education. There are a lot of conferences out there that cover a gamut, right? You can choose tracks, you'll maybe get one women's health topic out of the entire conference. And we're really trying to teach people endocrinology as it relates to ovarian, testicular, and adrenal health, and be very concentrated about it. So if you want to really understand all there is to know about women's health, like, we are trying to provide that education. That's what we're rolling into in 2020. And I couldn't be more excited because we get this feedback all the time. And we're going to do it.
I'm excited for that. Your work
Yeah.
is great. Dutch is a great company. I really am a big fan of the testing. So go check out the Dutch test. Where can they learn more about you and the Dutch test?
Well, Dutch Test is dutchtest.com. So that's easy. And all the videos, webinars, everything on there, podcasts, including this one, are up on, you just scroll through the links. And then for me, I'm all over Instagram. Absolutely. It's dr.carriejones.
Yeah, Definitely follow her on Instagram. I'm going to put a link for her handle down below, and the Dutch test and everything we spoke about. We'll have the resources down below. We have a great podcast notes person, Rachel, who puts everything down below. She does a great job. I want to acknowledge you, Carrie, for being a great educator, and I've learned so much from you over the years. You're also very funny. You're funny. You're a great educator. You care about people, and you really put out brilliant work. I've studied you for a few years via the FDN practitioner course, and I've learned about you through that. And I thank you for spending part of your day with me and all the women you continue to help, and all the women I help is a result of you. So I want to say thank you, and I really enjoyed this conversation.
Oh, Ben, I really appreciate that. Thank you so much. It's been a real honor.
Thank you.